Welcome to the video answers for question set 22. Let's get started. First question, which cardiac valve is most commonly involved in infective endocarditis and acute rheumatic fever? Overall, it's the mitral valve. Now, in IV drug users who get endocarditis, the tricuspid valve is often the first one affected, which makes some sense considering they're injecting their veins, so the blood returning to the heart from a contaminated peripheral vein is going to see the tricuspid valve first. Next, what disorders can cause cotton wool spots on the retina? First of all, what are cotton wool spots? Well, they're pale areas on the retina of various sizes, and they look like little wisps of cotton or loose wool. They're basically infarcts of the nerve fiber layer of the retina. Now, lots of different things can cause these cotton wool spots, but by far the most common causes are chronic hypertension and diabetes, diabetic retinopathy. They can also be seen in AIDS and in lupus, and rarely in sometimes vasculitis, specifically temporal arteritis or giant cell arteritis, also Wegener's granulomatosis, and polyarteritis nodosa. Next, what neurotransmitter levels in the brain are either increased or decreased in each of the following disorders? Now, this stuff's really important to know because not only is it going to help guide treatment, it's also going to help you understand why certain drugs are used for different disorders. So, in schizophrenia, you have increased dopamine, especially in the mesolimbic pathway. Parkinson's disease is primarily decreased dopamine in the substantia nigra, but you also have increased serotonin and increased acetylcholine. Alzheimer's disease is characterized by decreased acetylcholine. Huntington's disease is decreased GABA and decreased acetylcholine and increased dopamine. Anxiety, you have increased norepinephrine, decreased GABA, and decreased serotonin. And depression, you have decreased norepinephrine, decreased serotonin again, and decreased dopamine. So here you can see that with both depression and anxiety, you're going to have decreased serotonin, which is why SSRIs are most commonly used to treat either disorder. Next, name the syndromes below that are common causes of anovulation. So with elevated cortisol and central obesity, that's Cushing's syndrome. And then amenorrhea plus hirsutism plus obesity, think about polycystic ovarian syndrome or PCOS. Next, type 2 diabetic with hemoglobin A1C of 10 presents to your clinic with many complaints. You're concerned about the effect of the patient's long-term hyperglycemia. So what diabetic complications can be attributed to sorbitol-induced osmotic damage? So there are two basic mechanisms by which diabetes causes tissue damage. You can have glycosylation of blood vessels, where glucose is just tacked onto blood vessels in the kidneys, in the retina, and the coronary arteries. And the other mechanism is sorbitol-induced osmotic damage, which is what this question is getting at. So in the cells, glucose gets converted to the sugar alcohol sorbitol, and then normally sorbitol is converted to fructose. But in some tissues, like the Schwann cells and in the lens of the eye, they don't have the enzyme that converts sorbitol to fructose. So the sorbitol gets trapped in the cells, and there it acts as an osmole, and it's drawing fluid into the cells and causing swelling and damage. So that's the sorbitol-induced osmotic damage we're talking about here. So damage to the Schwann cells causes demyelination and diabetic neuropathy, and then damage to the lens causes cataracts. And then what enzyme converts glucose to sorbitol? So this is the enzyme aldose reductase. This is not the key enzyme that's missing in the Schwann cells. That one is called sorbitol dehydrogenase. This is aldose reductase, which is responsible for the earlier step, converting glucose to sorbitol. And you need to know both of those enzymes. Next, what's the underlying cause of DiGeorge syndrome? And then what are the manifestations? So the underlying cause is that the third and fourth branchial pouches fail to develop, resulting in aplasia of the thymus and the parathyroid glands. Usually this occurs because of a gene deletion on chromosome 22. Then for the manifestations, these patients can have tetany, because without parathyroid hormone they're going to have hypocalcemia. They can have recurrent viral and fungal infections because they don't have a thymus, so the T cells can't mature. And then if it's a chromosome 22q11 deletion, you can also see cleft palate, abnormal facial features, and congenital defects of the heart and great vessels. Next, in your own words, describe what type 2 error is. So we talked about type 1 error in one of the earlier question sets, and now we're talking about type 2 error or beta error. So this is where your study results demonstrate no difference between two groups when in fact a difference really does exist. So if you did a study that showed that insulin is not helpful in treating type 1 diabetes, your study would of course be erroneous. And that particular type of error is called a type 2 error or a beta error. Next, What efferent fibers carry input from the brain that influences the outer hair cells of the cochlea in much the same way that gamma motor neurons influence muscle spindles? Now, we're going to talk about gamma motor neurons and the muscle spindles in the Part 2 videos. But here we're talking about signals going from the brain to the cochlea, and these are carried by the olivocochlear bundles. They go from the superior olive to the cochlea. And then the result of this input is that you have contraction of the outer hair cells and stiffening of the basilar membrane in the cochlea. That's going to sensitize inner hair cells to a particular frequency so that you can deliberately listen for and discriminate specific sounds when there's other background noise going on. And then what's the result of damaging the outer hair cells, such as with antibiotics like gentamicin or streptomycin? So you can have wide deflection of the basilar membrane rather than sharp deflection, and that's going to cause significant hearing loss. Next, what are the risk factors for osteosarcoma? So bone infarcts, radiation, Paget's disease of the bone, and a familial retinoblastoma, which is a mutation in the RB gene, male sex, males are at increased risk compared to females, and then also being 10 to 20 years of age. It's the most common age of presentation. And the last question, a child in India is brought to the doctor with symptoms of muscle weakness, malaise, headache, fever, and hyporeflexia. For the past few weeks, he had been swimming in a waterway known to contain sewage. You think this boy has contracted a pathogen via the fecal-oral route. What area of the body is this pathogen attacking to give the neurologic symptoms seen? So unfortunately, these neurologic symptoms are caused by poliovirus, which is transmitted via the fecal-oral route. So this virus replicates in the oropharynx and it spreads into the blood, and from there to the CNS, where it leads to destruction of cells in the anterior horn of the spinal cord, which ultimately causes lower motor neuron destruction. And that brings us to the end of question set 22. I'll see you next time.